How to make a Myerson EMA anti-snore device. To begin, turn the unit on. You'll be prompted to clean the heat sensor using a soft cloth. Wipe the heat sensor in a circular motion. To use the Myerson EMA material, you may first have to program your Erkoform 3D motion. First, tap on the New Foil button. Enter the name of the material. Then, enter the thickness of the material. Next, enter the final heat temperature. Finally, enter the cool-down time. You can verify the program by tapping the Favorites button. Examine your duplicate models thoroughly. Look for any distortions or bubbles. Using a plaster knife, clear out any bubbles or inclusions that may have occurred during the duplication process. For the hard EMA material, you will need to block out all of the deepest undercuts, such as in the embrasures and interproximal areas. The blockout material shown here is Adds-It base. The technician is slowly going around the gingival areas and filling in all the deep depressions. Next, spray an accelerator to cure the blockout material quicker. Allow models to dry on the bench top for 30 minutes, or dry models under ventilation for 10 minutes. Evaluate that the blockout is complete. Next, mark the center line on the upper and lower models. Place the 25mm EMA template on the model. Mark the upper model on the interproximal area between the cuspid and the first bicuspid. Line the template up again and mark the lower model. Do the same for the opposite side of the arch. Using a black permanent marker, redraw the markings on the model. This will make it easier to see through the thermoformed material. Start the Erkoform 3D by pressing the Favorites button. Select Myerson EMA 2.5mm material. Verify the heat temperature and the cool-down time. Tap the green check mark to begin the program. The Erkoform 3D will show you a quick video explaining the next steps. Bury the base of the model in the granules. Fill in low areas and the palate area with extra granules. Make sure there are no granules on the rim of the pressure pot or on the teeth of the model. Remove an EMA thermoforming disc from its packaging. Notice the label on the top side of the material and peel it off. Remove the locking ring from the foil holder. Place the EMA disc with the label side up into the foil holder. Reattach the locking ring. Turn the foil holder underneath the heating element. This will automatically start the heating cycle. When the heating cycle is about halfway through, the vacuum pump will start. When nearing the completion of the heating cycle, an audible sound will be heard and a red light on the control panel will flash. A warning will also be displayed to keep your hands free of the Erkoform machine. When the heating cycle is complete, the Erkoform 3D motion will automatically turn the heated foil to the forming pot and drop it into the model. The unit will then activate the rapid vacuum pot and form the heated foil to the model. The cool-down timer will automatically begin. When the cooling cycle is complete, the vacuum pump will release and the display will show another short video of the next steps. Release the locking ring and remove the foil. Lightly tap on the foil to dislodge any granules that have stuck to the foil. Replace the locking ring to the foil holder. Lift and turn to the right. Load a Brasseler H219 cutting burr into a slow-speed handpiece. For the upper model, start cutting the material on the lingual side. Cut in the shape of the teeth about 3 mm from the gingival edge. Continue cutting the facial of the model. Stay about 5 mm away from the teeth, cutting straight across. When your initial cut is complete, cut a line from the back molar to the edge of the foil. Using a plastic knife, gently pry the device off the model. Some teeth on the model will break during this process, and that is normal. Then, spread the remaining formed material from the model and allow the model to fall out of the foil. Using a brown Lisco disc, do bulk reshaping along the tissue edge of the device. On the facial, try to get the device as flat as possible. On the lingual, follow the shape of the initial cut, staying about 1 mm away from the teeth. Next, go over the edges of the appliance and slightly round the edges. Using the blue Lisco disc, refine and smooth all edges. Hold the appliance at a slight angle to round the edges. The finish lines for the upper should appear as follows. Posterior buccal, approximately 1 to 3 mm from the gingival. Anterior facial, at the gingival line. Lingual, approximately 1 mm scalloped from the gingival. Remove the inner spacer with a knife. Inspect the device for accuracy. Use the same steps with the lower tray. Start by thermoforming the tray. Coat out the tray. Cut the lingual flat, staying about 5 mm from the gingival. Remove the tray. And finally, refine with the brown and blue Lisco discs. The finish lines for the lower should appear as follows. Posterior buccal, approximately 3 to 5 millimeters from the gingival. Anterior facial, at the gingival line. Lingual, approximately 5 millimeters flat from the gingival. Remove the inner spacer with a knife. With the trays back on the models, use a brown Lisco disc to roughen the buccal areas marked on the lower model. Also, roughen the occlusal area above the first molar. Next, roughen the buccal area that was marked on the upper model. To prepare the acrylic, add acrylic powder to a mixing cup. Then add monomer liquid. Using a spatula, mix the acrylic thoroughly. The acrylic may be runny at first, so let the mixture set up on the bench until it has reached a doughy state. Add a small amount of monomer to an empty mix cup. Check the mixture to verify its consistency. Using a spatula, scoop a small amount of acrylic mixture and place it on the areas above the first molar. Wet the spatula with the monomer liquid and shape. Do the same on the other side of the arch. Place acrylic on the buccal area over the marks on the lower model. Place the guide pads on the occlusal area above the molars. Then, place the strap hooks on the buccals. Place the hooks facing distally and downward. For the upper, place acrylic over the marks on the buccal area. Then place the strap hooks. Place the hooks facing mesially and upward. Closely examine the placement of the bite pads. Make sure they are on a flat plane. Place the models into a pressure pot. This will aid in curing the acrylic. Lock the lid onto the pot. Attach a compressed air line. Air pressure should be between 13 and 23 psi. The water temperature should be 85 degrees Fahrenheit. After 2 minutes, remove the air hose from the pressure pot. Release the air by pressing the release valve. Open the lid and remove the models. Take the trays off of the duplicate models. Dry the inside and outside of the trays using a clean cloth towel. Place the trays on the master models. Inspect the trays for fit. Using a small torch, quickly run the flame over the trays to create a high gloss finish. Remove a set of yellow 21mm EMA straps from the strap kit. Slip the straps over the hooks on the upper tray. And then over the hooks of the lower tray. Lastly, perform a final QC of the appliance before delivery.